Let's go, my beloveds. Pedagra or gout. Gout or pedagra. Okay, so today's topic, it's gout, pedagra, at the same time. It's actually the same thing, we can say. My beloveds, let's clarify several confused questions, misunderstood questions that I remarked during these previous years concerning your autoimmune disorders, especially about gout. So take your pens, papers, and let's go. Firstly, the gout commonly referred to as a pedagra when it affects the big toe. So gout of a big toe is a pedagra. It's a form of inflammatory arthritis characterized by the deposition of monosodium urate crystals, where, of course, in joints and soft tissues. It's notorious for causing excruciating pain and swelling. Okay? Very notorious for causing excruciating pain, my beloveds, and swelling. So about pedagra, one of the most confused questions. So the most common initial manifestation of gout is acute monoarthritis and of the first metatarsophalangeal joint, MTP. Metatarsophalangeal joint, I arrived. Metatarsophalangeal joint known as a pedagra. So knowing that gout most often affects the big toe, now in my life, maybe it's a 99% of all pedagras, of all gouts was pedagra. So knowing that most often affects the big toe, helping is in making quick and accurate diagnosis, especially during an acute attack. So if you see a big toe problem in guy, with highly likely, this is a pedagra. About urate crystal deposition. So the root cause. Gout occurs due to hyperuricemia, where monosodium urate crystals accumulates in the joints and periarticular tissues. These crystals trigger intense inflammatory, immune and autoimmune response. What is clinical issue of that? The understanding the pathophysiology aids in targeting uric acid reduction as a primary treatment strategy. About diseases of the kings, diseases of nobles, diseases of rich man disease. Historically known as this, of course, so disease of the kings, rich man disease of the nobles, gout was associated with excessive meat and alcohol consumption. Okay, no, it's historically, traditionally, if you want. So clinical importance, dietary counseling is essential in managing to reduce the intake of purely-rich foods and alcohol. But the question is not here. Actually, I want to clarify this in your future medical practice. This is not a question of intake of food or alcohol. Of course, it always provocative, triggers the pain. But the problem is a lack of drinking pure water, normal water. Lack of drinking water, because it's not a question of eating meat. Meat, of course, it's a trigger, but the problem is the lack of eliminating of this uric acid from the body. So how to eliminate? Hydrophilic, of course they are. Only and only drinking water. A good quantity of water. And then we check, we see, is this purine-rich foods or alcohol play a role? Water is an answer. No, you don't answer in this manner. You said, of course, you purine-rich foods and alcohol. But remember, and give this advice to your patients. Drinking normally water. Water, not liquid, not juice, but water. Normal, pure water. What about genetic predisposition? Yes, of course there is genetic predisposition. It's not a dominant, but predisposition. Genetic factors play a role with mutations URAT1 and GLUT9, genes affecting renal rate transport. You maybe not remember. It's not mandatory to remember all these mutations, but you said yes, there is a genetic predisposition. That's why a family history should be considered when assessing risk factor for hyperuricemia and gout. Actually, my good advice, not only for hyperuricemia, I ask a question because hyperuricemia we know, and podagra, of course, gout. It's play a major part of encompassing in metabolic syndrome. So when you ask questions about family history, don't forget about asking all chains of metabolic syndrome, and diabetes mellitus, and arterial hypertension, and obesity, and cholesterol, lipid profile, etc., 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 etc. Then about TOFI, my beloveds, my dear students. TOFI formation is a chronic complication. In chronic cases, TOFI can form presenting nodular masses of urate crystals under the skin, commonly on fingers, toes, and ears. Ears, very often. Clinical importance of that. So early treatment of gout is crucial to prevent the formation of deforming TOFI and chronic arthritis. Then about joint fluid analysis, the gold standard for diagnosis. So joint aspiration, if we can perform that, of course. Joint aspiration reveals needle-shaped, negatively birefringent crystals. Birefringent crystals. Negatively birefringent crystals. Under polarized light microscopy. So joint aspiration reveals, I repeat, reveals needle-shaped, negatively birefringent crystals. My pronunciation is awful, I know. Under polarized light microscopy. What is clinical issue of that? The definitive diagnostic method helps differentiate gout from other types of arthritis like pseudogout, calcium, pyrophosphate crystals. What else? First line therapy, of course, is NSAID and now colchicine. About this colchicine, my beloveds, and NSAIDs. Acute gout attacks are managed primarily with NSAIDs, colchicine, and corticosteroids. But colchicine works perfectly. So clinical issue of that. Starting treatment promptly at the onset of symptoms helps reduce severity and duration of the attack, and in the brilliant manner. About allopurinol and fleboxostat. Fleboxostat. Dexantine oxidase inhibitors reduce uric acid synthesis and are used for chronic management. Clinical importance, educating patients about lifelong adherence to urate-lowering therapy is vital to prevent recurrent attacks. But the crucial, my beloveds, it's drinking water. Then physical activity, then maybe, why not, this allopurinol and fleboxostat. Okay, drinking water. And finally, lifestyle modification, essential and often overlooked, unfortunately. Reduction of overall alcohol, red meat, and fructose-rich food significantly lowers uric acid levels, but I repeat, drinking water. So, clinical issue of that. Combining pharmacological and lifestyle interventions yields the best outcomes in gout management. So, gout is more than just a painful joint disease. It's a systemic metabolic disorder that requires a comprehensive approach. And not all, so you have to remember about this hyperuricemia. Not all hyperuricemia it's a gout at all. Huh? That's why recognizing the classic presentation and understanding the pathophysiology ensures early diagnosis and effective treatment, preventing chronic complications like TOFI and severe joint deformity and quality of life. So that's all, I suppose, that's all concerning your confused questions on a big board exam. Thanks for your attention. Don't forget to follow and subscribe my Dr. Y YouTube channel, WHY. The same, don't forget to follow my Telegram private channel, Dr. Y, W-H-Y. It's in Telegram, my private one. Dr. Y, W-H-Y. So like question, why? No, without question mark. Dr. Y. We know Dr. Who, I'm Dr. Y. So you tap in searching mode Dr. Y, W-H-Y. You find it's a bot. You click start, you choose your plan, it's very cheapy. And we will talk. You will find a lot of questions like this, MCQ questions, tests, your oral big exams questions, how to answer, students' cheat sheets, presents, gifts, why not? It's at clinical cases, why not? So stay blessed. See you on my Telegram channel, Dr. Y. Bye, 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 bye.